Hello, my name is Dr. Lawrence Reed. I'm a board-certified plastic surgeon. Been practicing in New York for many, many years. And one of my great passions is the use of injectables for several reasons. One is for rejuvenation, to look younger, and two, many of them have very functional and practical uses. For example, Botox, which is used very frequently to diminish wrinkles and lines that people don't like, is also very, very helpful in correcting migraines in many, many people and other disorders and muscular malformations that cause distortions of the face. So it's both a cosmetic and functional agent if used properly. Some of the other drugs we use, such as Juvederm and Rays, also have those properties. They're both cosmetic and functional. So that appeals to me greatly, and it's an extension of the plastic surgery modalities that we use. This lady presents with wrinkles of the forehead and glabella area. The glabella area is this area over here, and sometimes called the 11 lines. Could you bring your eyebrows together? You can see all the wrinkles that form. These are caused by 5 muscles: the procerus, the corrugator, and the supercilious muscles. Relax. Raise your brows now. This is another problem, is wrinkles of the forehead, and that's caused by the frontalis muscle there too. So now, on this young lady, I'm going to show you how we do this. We're going to put her in a slightly reclined position. Another concern with the patients is what we call the crow's feet. Tighten your eyes, and you can see these lines here. They're called crow's feet, and that's due to the tightening of the orbicularis oculi muscle. So we're going to also block that. So here is my protocol for doing this in my technique. One, I use a very small syringe. This is loaded with Botox, and the tiniest needle you can get, which is a 32 gauge needle. I inject 5 sites here to get the procerus and corrugator and supercilious muscles. The injection is beneath the skin and near the muscle, but Botox spreads almost 3/4 of an inch, so you don't have to be exactly precise. Bring your eyebrows together. So now I know her muscle pull starts from here. Relax. So I'm going to go from here over. I'm going to give you 1/10 of AC at each site. Now the procerus muscle. Now the other corrugator and supercilious muscles. Now, because the orbicularis oculi muscle tends to pull the brows down, I don't want the brows pulled down, I'm going to give a small injection to the orbicularis oculi as well to prevent it from pulling the muscle and the brows down, which gives a stern look. Now, as soon as I finish the injection, I apply pressure to the area to reduce the swelling. So when the patient leaves, there should be no swelling and hopefully no bruising. Now to get the frontalis muscle, raise your brows again. This is to prevent the wrinkles. Drop it. I use 5 injections. This is like an inverted V, or a V really. When I inject, I look to make sure I'm not near any big veins or vessels, so I don't hit them by mistake. Now, by avoiding the lower 1 inch, I'm not worried about her brows not being able to move, so she still has expression and animation. So I block the procerus, corrugator, and supercilious muscles, which pull the brows down, so the brows will stay at a normal height. I block this, so she wouldn't have wrinkles, and left this open, so her brows be at a normal and youthful height, and we can even raise her brows with this technique. Now, I'm going to take care of her crow's feet. I use a small dose here. Now, I want to see what the expanse is, so squint your eyes together, relax. And here I'm going to put 4 injections. Now you notice, bring your eyebrows squint your eyes again. I'm not really going for the lines, but I'm spreading it out so I know I'm going to get into the muscle. I need much less here. And my goal is always to leave some semblance of expression. No one likes a flat, lifeless look today. So I don't want a flat face. I want a face that has some animation left. So there may be a few lines, but it looks natural. It's not the lines they came in with, but I do want to see animation. Now go to this side, relax. Okay, relax. We try to upset the muscle pull here so that one, she loses these wrinkles here to a large degree. Her eyebrows can come to a nice height. They're not being dragged down by these muscles, and the crow's feet dissipate. But she'll always have enough left to have some animation, which I think is very important for a normal person. And it doesn't look normal to see someone when nothing is moving. And everyone knows that today. It's the famous "the face is frozen" joke. So I try to avoid that whenever possible. And that's it. It's that simple. Doesn't take a long time. Now, you don't see the result right away. It takes about a day or two to happen, sometimes up to a little bit longer. And I always tell a patient, if you haven't seen a result in 2 weeks or 3 weeks, it's probably not going to happen, because about 1 or 2% of the bottles are not biologically active, so then they come back and we touch it up, and that happens from time to time. Thank you. Okay. Just about a month ago, I injected Botox into this young lady's face. At that time, she presented with vertical lines here called the glabella area, transverse lines of the forehead, and crow's feet, which are the vertical or radiating lines on either side of the eye. So if you look at the forehead, raise your eyebrows up. I always leave the eyebrows so they can have motion, but you can see nothing happens here. That's because I only use Botox on the upper part of the muscle and left the lower part of the muscle, which lifts the brow, alone, so you can raise the brows. Bring your eyebrows together. They almost don't come together because we put Botox there. Normally, she could have gotten together like this, but now she can't. So the Botox worked beautifully here, and yet left, raise your brows, elevation of the brows, so she can be surprised, angry, laugh, or smile, and it looks normal. And the last thing we did was her crow's feet. Tighten your eyes a little bit. You can see that all the crow's feet are basically gone. Just a few left, which is normal and not unattractive in any way. To me, what Botox is about is not to destroy animation or make the face look lifeless, but to create a face that looks more refreshed, more youthful, but still alive and viable, and one that can respond to emotions and show that the person has animation. So that was done. I'm very successful in this case.